238 Aphorism Organon of Medicine. It is only when the suitable medicine has, with a single dose, destroyed several fits and manifest health has ensured, but after some time indications of a new paroxysm appear, only then can and must the same medicine be given again, provided always the totality of the symptoms is still the same. This recurrence of the same fever after an interval of health is, however, only possible when the noxious influence that first excited the intermittent fever still continues to act upon the recovery, as happens in marshy districts, in which case a permanent cure is often only possible by the removal of this exciting cause, as for instance a residence in mountainous country if the case was one of the marsh intermittent fever. Section 238 is rewritten in the 6th edition as follows. Not infrequently, the suitable medicine has with a single dose destroyed several attacks and brought about the return of health, but in the majority of cases another dose must be administered after such attack. Better still, however, when the character of the symptoms has not changed, doses of the same medicine given according to the newer discovery of repetition of doses, see note to 270 aphorism, may be given without difficulty by dynamizing each successive dose with 10 to 12 successions of the vial containing the medicinal substance. Nevertheless, there are at times cases, though seldom, where the intermittent fever returns after several days' well being. This return of the same fever after a healthy interval is only possible when the noxious principle that first caused the fever is still acting upon the recovery, as is the case in marshy regions. Here, permanent restoration can often take place only by getting away from this causative factor, as is possible by seeking a mountainous retreat if the cause was a marshy fever.